Good evening. It is our honor to be here with you today to present this introductory webinar about LSVT Loud and LSVT Big, speech, physical, and occupational therapies for people with Parkinson's disease. And we'll also touch on some applications to other neurological disorders. So my name is Angela Halpern. I am a speech therapist, and I'm the Chief Clinical Officer for LSVT Loud for LSVT Global. And I'm going to let my colleague Laura introduce herself.
Hi there, welcome everyone. My name is Laura Goussai. I'm a physical therapist and the Chief Clinical Officer of Lsvt Big. We are delighted to join you today.
So a little bit of history. This webinar came about as a discussion as a part of a group with the World Parkinson Congress Committee that I'm on about the need for more trained and certified LSVT therapists in Africa. So this initiative was brought about to do these introductory webinars so therapists and allied health professionals can learn more about LSVT. And so to that point, I'd like to take a moment to specifically thank the following individuals who were really helpful in getting this information out about the webinar. So Tosh Fothergill Misbah, Fiona Robinson, Karen Casey, and Altuf Mapara. So we really thank them. You may have received information from them yourselves. Now, as we're doing our introductions, we would love to know where you are joining us from this evening. So if you look at your toolbar, you'll see a question box on the toolbar. So if you could please type in the country you are joining us from into that toolbar now, then we can scroll through and look at where you're joining us all from. So go ahead and type that into the toolbar now. And for the rest of these slides, we're going to turn off our camera so you can see the slides fully. So I'm just going to turn my camera off there, and we'll go on to the next slide. So I'm not going to walk through this in detail, but here you'll see more information regarding Laura and myself. All of this information is in the slide handout that's available for this webinar. You can access the handout in the toolbar under your handouts, and you'll see the slide handout as well as a handout that's in Swahili regarding basic information on voice and speech and swallowing, and then another one on movement. These are intended to be basic educational handouts for people with Parkinson's disease and their caregivers. We developed these in collaboration with Tosh Misbah as a part of the educational initiative that she's involved in Kenya. We realize Swahili is just one of the many languages spoken on the African continent. So if you would like these basic educational resources available in other languages as well, please put that into the question box and we can follow up with you specifically about that. So in the next slide, as you learn about today's webinar, LSVT Loud and LSVT Big therapies are solidly based on many years of research. We've been fortunate to have funding from the National Institutes of Health for 3 of the large randomized controlled trials, and also funding for other studies that's listed here on this slide. Laura and I do fully disclose that we have both a financial and a non-financial relationship with LSVT Global, non-financial being a preference for LSVT Loud and LSVT Big as treatment techniques, and financial being we are employees of LSVT Global and receive consulting fees and travel reimbursement from LSVT Global. So we're going to go over a few logistics now for the webinar. And at any time, if you have questions, please type your question in the question box. We will save time at the end to answer those questions, but as you think of them, please go ahead and type those in. All of your microphones are muted for purposes of the webinar, so we don't get interference from noise from background environments. And so we're going to go through the content, we'll do your questions, and then at the end of the webinar, once you exit, there will be a survey. We do kindly ask you to complete this survey. It's going to give us the best information about the types of resources that are needed by you so that we can follow up with that. So we're going to move on to some polling questions. Oh, first I'll go over the learning objectives. So during this webinar, we hope by the end that you feel you are able to describe the need for effective speech, physical, and occupational therapy interventions for people with Parkinson's disease, be able to discuss the development and data on these efficacious treatments, LSVT Loud, the speech therapy, Lsvt Big, physio-occupational therapy, understand the basic treatment concepts behind LSVT Loud and LSVT Big, and know how clients can find certified therapists and how you could get training and certification if you're a speech, physical, or occupational therapist. Now we'll go on to some of the polling questions. And Laura's going to introduce these to you, and also I think she'll probably have some feedback about the countries people are joining us from.
Yeah, thanks, Angela. Let's do that first. We had a lot of fantastic responses from where you're from. It looks like quite a few people from Africa, different parts of South Africa, excuse me. And I see someone from Mombasa, Kenya, another person from Kenya, and let's see, some different places in South Africa, a lot of people from South Africa. Great to see all of you. And Angela, we have some requests for handouts in English, and we do have these same posters in English as well, and we can send those to you in a follow-up email. A few other requests for them in Afrikaans and I think another language as well. So thank you for all of your responses. I think it's interesting to see where everyone is joining us from. So we have two quick polling questions. I'll launch these in just a moment, but the first is very easy. We just want to know who's joining us. Are you a physio, an occupational therapist, speech therapist, a nurse or physician? And apologize, that's in one category because we only have so many spaces. And other, and other could mean a variety of things. So let me launch this first polling question, and you will have about 30 seconds to answer it, and then we'll share the results. Just give it a bit more time. It looks like 3/4 of you have voted. Okay, and it looks like almost everyone has had a chance to vote, 85%. And what it shows us is that 16% of you are physiotherapists, 16% of you are occupational therapists, so 32% altogether, 67% speech therapists, and 2% others. I'm just going to share that poll with you so you can take a glance at it real quick. This helps Angela and I quite a lot to know who our audience is and as much as possible tailor our presentation to you. Okay, so we have one more poll, and this one is approximately how many people with Parkinson's disease have you treated in the last year? It could be none, 1 to 5, 6 to 10, 11 to 20, or more than 20. This is just your best guess that you can muster up in the next 30 seconds. So let me launch this poll. And again, you'll have about 30 seconds to vote. Just a few more seconds. Looks like almost everyone has voted. Certainly, if this doesn't apply to you, you don't have to vote. All right, I'm going to go ahead and close that. And before I share the results with you on the slide, just so you know, 35% of you say you haven't treated any people with Parkinson's within the last year. 45% say between 1 and 5. 14% say 6 to 10, and 6% says 11 to 20. And no one answered more than 20. So let me go ahead and share those results with you as well so you can take a quick glance. So great to know this. This also helps us to be able to not only tailor this webinar, but provide you with resources in the future, hopefully, that are applicable to you. All right, I'm going to turn it back over to you, Angela, or is it my turn?
And it is me. You are correct. Yes. Thank you again, everyone, for that poll. As Laura said, that really helps us to tailor as we're talking to you today. Well, let's dig right into the presentation and why Laura and I feel so passionate about disseminating this information about these therapies to you. Parkinson's disease is a global concern. We see that up to 8 million people worldwide are living with Parkinson's disease. And this number of people with Parkinson's is expected to double by 2040. So it's really clearly apparent why we need as many people as possible to be able to deliver services to people with Parkinson's disease. Next slide. Our mission at LSVT Global is to empower people with Parkinson's disease to restore and maintain their highest levels of function in relation to communication, mobility, and how this helps them with independence in daily life. And we are committed to doing this through scientifically supported therapy programs, LSVT Loud, the speech therapy, Lsvt Big, physical and occupational therapy. And this word empower is something that we feel very strongly about, that is essential to improve quality of life. We want our patients to take control of their Parkinson's. In fact, I had a woman once tell me following the speech therapy that with Parkinson's disease, there's many parts of Parkinson's she felt she couldn't control, but she had learned how to control her voice, and that can be really empowering. So on the next slide, we'll see that with this mission, we have made great strides. There are over 40,000 LSVT clinicians in 75 countries that have been trained, but it's been recognized that we need many more therapists to deliver these treatments, and especially in the continent of Africa. So, thus, the initiative for starting education with this webinar. So we're going to go next to a video. The first one you're going to see is of a 59-year-old female, 2.5 years post-diagnosis. And the video will have a pre and a post, before and after 1 month of intensive LSVT loud speech therapy. Listen to the changes that you'll hear post-treatment in her voice and speech, but also take note of the other changes that you might see that we'll discuss a bit after the video. It's important to note that medications did not change over this month of treatment, so the results you see are due to the behavioral treatment. So let's go ahead and take a look at her video now.
Have you noticed any changes in your speech or your voice that you would associate with Parkinson's?
Yes, I don't speak loud enough a lot of times.
Anything else?
Hoarse.
Uh-huh. Anything else?
I stutter, which I never did before.
Do this for me if you would. Take a deep breath and say ah for as long as you can.
Ah.
Good for you. Okay. Would you say Parkinson's disease has caused you to talk less?
Yes.
Because?
Because I stutter and then I can't be heard. If there's noise in the house, like when the kids come over, nobody pays attention to it because they can't hear me. Until I get mad and then yell.
Take a deep breath and say ah for as long as you can. Have you noticed changes in your speech or your voice as a result of the speech therapy?
Oh, yes.
What have you noticed?
I talk louder. I think louder. I'm going to sing with the Sons of the Pioneers one of these days with my voice.
Good for you. That's excellent. What practicing do you do at home?
My ahs, my highs, and my lows. And I read out the mail out loud.
Excellent. Do you feel like practicing helps?
Oh, yes.
Do you feel as though people can understand you all of the time now?
Majority of the time, unless it's my husband, and he'll say, "What? I can't hear you."
Good for you.
But I think he does that just to be cute.
I think he does too. Has anyone commented that it's easier to understand you now?
Oh yes, I set some of our friends back when we went to their house and I talked loud. Lou says, "What the hell happened to you?" My daughter said, "Oh, Ma, that's you?"
Isn't that good? Don't you feel wonderful?
Oh yeah, because now she can't say, "I didn't understand what you said."
Right? No excuses, right?
Yeah,
That's
no
right.
excuses.
All right. So what do you do when you want to be as easy to understand as possible?
Think loud.
All right. So this was 1 month of intensive treatment, and we're going to walk through what that program involves in just a bit. You could hear those changes in the loudness of her voice. She was increased to a normal loudness level, and that's an important point to make. With the LSVT therapy, we're never getting people too loud to a yell or a scream. It's just normal loudness with healthy voice quality. You could also hear that increased improvement in voice quality. But the other things you might have noted that went beyond just voice and speech were that spreading of effects, that glimmer in her eye, the increased facial expression. And I'll actually briefly touch on some data we have showing pre-post changes in facial expression later. So now let's look at an example before and after Lsvt Big, and Laura's going to introduce this to you.
Okay, so this next video is parallel in that it's a before and after Lsvt Big video. And later in our webinar, you'll understand a little bit more about how parallel these two treatment methods just are. So this one is of a gentleman who was 71 years old. At the time of the video, he had had Parkinson's disease for 14 years. The reason for referral was difficulty with walking. He had slowed down with his movement. He was beginning to have some falls, and because of that, he started to use a cane. He also was experiencing freezing of gait. Just like Shirley, his Parkinson's medications were optimized before he started the behavioral intervention of Lsvt Big, and he had no medication changes during the month of therapy to account for his improvements in movement. So he underwent Lsvt Big, which is an intensive 1-month physical or occupational therapy program. And in this video, there's no audio, so I'll keep my audio on and narrate through the video so you can see what you're, understand what you're seeing. So let me pull this up now, and we call this gentleman Bernie. On the left side of the screen, when it starts playing, so on the left side is him walking out on the first day of treatment. On the right side is him walking out after the last day of treatment. I think immediately you can see he's not using the cane. He's walking faster. He's walking with longer stride length, more amplitude of his arm swing. He did not freeze going through the doorway, which clearly he's having some hesitation of his gait. You can see that he's just on the brink of probably freezing. And he's going out to the parking lot to his car. So you can see how slow it is compared to how his wife is walking pre-Lsvt Big, and post he already went past his car and is now circling around the parking lot to show off a bit. But one of the things you may not notice is that no one is standing beside Bernie cueing him. This is an internal cue that he learned how to walk bigger and better on his own, and he's able to do that without external cueing. And that's one of our key goals in Lsvt Big and Lsvt Loud, is to train intensively enough so they learn this new internal cue. I'm going to bring it back to the main screen now. And let's move on a little bit and just talk about Parkinson's disease. Now, from your answers, I know that some of you haven't seen any patients with Parkinson's over the last year, and some of you just a few. But I'm sure you did learn some in university when you were becoming a therapist. If you remember back, the primary motor symptoms are bradykinesia, which is slow movement, hypokinesia, small movements, rigidity, and tremor. And those are called the cardinal symptoms of Parkinson's disease. But what makes it so complex is it's not just a motor disorder. There are a variety of non-motor symptoms that are almost as disabling, if not even more disabling than the motor symptoms. We note that they have higher rates of depression and dementia, also have anxiety and apathy that impact their willingness and motivation to move and to engage in daily life. There's psychological and cognitive changes, difficulties with attention, dual tasking, and things like that. There are sensory and proprioceptive changes that we'll talk about a little bit later in our webinar and how those impact movement and speech. There's also autonomic dysfunction, such as bowel and bladder dysfunction, hypotension, sexual dysfunction, and a range of sleep disorders as well. So as therapists, initially it can be overwhelming to think, how on earth can I possibly address all these symptoms in this very complex disease? And that, I think, is part of the beauty of Lsvt Big, is how it keeps it simple, but yet does not neglect to address these underlying non-motor symptoms as well. Hypokinesia is what we target with the LSVT programs, and it's important for you to note that this smallness of movement affects both speech and movement, and it's progressive in nature. So when a person is first diagnosed with Parkinson's disease, their voice may appear, sound relatively normal, but there's a subtle hypophonia that can be detected. There's also subtle changes in movement, usually subtle reduction in arm swing on one side upon diagnosis, enough so that they got a clinical diagnosis, right? So as we see them progress with their Parkinson's disease, we will note a progressive decrease in loudness in speech, hypophonia, and this is fairly universal across people with idiopathic Parkinson's disease. We notice progressive decrease in the amplitude of small motor movements like handwriting. They develop micrographia. We see progressive shortening of stride length and arm swing when they're walking. And this extends to, reaching activities and other activities of daily living as well that rely upon movement amplitude. Lastly, we see a progressive decrease in their speed and amplitude duration with their fingers and limbs when you do a repetitive finger tapping activity or a repetitive foot or heel tapping activity. And Angela's going to talk a little bit more about the speech and voice impact.
Yeah, so as therapists, you may have noticed, those of you that are therapists, that some people are not aware that voice and speech can be impacted in Parkinson's disease. But when we look at the research, we see that over 89% of people with Parkinson's disease worldwide do notice problems with voice and speech at some time during the disease progression. So education about this is really important. For some people, voice and speech symptoms are even noted before diagnosis. In fact, I'm working with a gentleman now that this was the case for. He was giving a speech a few years before he was ever diagnosed and noticed it was difficult to project his voice. And then a couple of years later was diagnosed with Parkinson's disease. We are really advocates of early intervention. Get treatment early, keep voice and speech strong, keep movement going. Don't wait until it's a bigger problem later. So we see here with the voice and speech symptoms, and you notice some of these in the video you saw, of reduced vocal loudness, a hoarse, harsh, or breathy voice quality. People's voices can become monotone. They'll say my voice sounds flat or robotic, and they might have imprecise articulation. And we see in the study by Miller et al. That even people who are clinically asymptomatic for speech deficits are still reporting feelings of embarrassment, social stigma, social isolation, due to speech concerns that they may not be able to exactly pinpoint due to some sensory deficits that we'll talk about in just a bit. And I'll go on to Laura to describe some of these motor symptoms.
Yeah, so how do the motor and non-motor symptoms affect function in Parkinson's disease? Many, many ways. And this is just a small sampling of what you might see typically in your patients with Parkinson's disease. And this goes for both speech and for movement as well. We see great difficulties with dual tasking that affects efficiency, even early in the disease. We've seen many clients that have difficulty maintaining a normal amplitude of arm swing and stride length while they're talking. And in order to focus on the amplitude of, their gait, sometimes then they diminish their voice. So to maintain amplitude adequately for everything, both communication and movement at the same time, can be quite difficult. Balance and stability can affect safety in the home, at work, out in the community. Many times they have fear of falling. Even if they haven't had a fall, they sense that their balance isn't what it used to be, and they start to limit their activities in daily life because of that. When they're moving slower, they're just not as efficient. It might take longer to get dressed in the morning or to do activities such as preparing a meal. We find difficulties with initiation affects time on task as well. Maybe it takes them longer to get going, to get out of a car, so they have to now plan more time to get to appointments and to work and such. Many people have tremors that affect their ability to manipulate objects, such as writing utensils or eating utensils or typing or using their mobile phone. And lastly, apathy is a huge one for many people that can affect their motivation for treatment. They just don't have that drive or get up and go to engage with others in either communication settings or doing hobbies or leisure activities. Things that they really normally enjoy doing seem very effortful after developing Parkinson's disease. So rehabilitation, fortunately, is becoming a routine part of management in Parkinson's disease to address all of these complex symptoms. And medication can't solve everything. We know that medication isn't always helpful for balance or for voice and speech. And that's where we really come into play as speech, physio, and occupational therapists. So long ago, it used to be get your diagnosis for Parkinson's and go straight to the pharmacy for your prescription of Sinemet or some other medication for your symptoms, not accessing therapy services until late in the disease when their voice had become so soft that people couldn't hear them at all. They're having swallowing issues or falls or major functional issues. But today, thanks to all of the science that has come out on evidence-based therapies like LSVT and the importance and value of exercise, more and more physicians now are not only prescribing medication, but also therapies upon diagnosis, so that it becomes a way of treating the primary symptoms of PD and not just the secondary symptoms of Parkinson's disease. And so we're going to talk about LSVT Loud and LSVT Big as examples of these evidence-based therapies that are available to people with Parkinson's disease. We're going to start off by talking about the parallel concepts that both of these treatments share. Now, one thing that you might want to know is that LSVT Loud, the speech treatment, preceded LSVT Big, the physio and occupational therapy treatment. LSVT Big was developed from the principles of LSVT Loud, and this is why they have these parallel key concepts. We found out that they work for LSVT Loud, and now we find that they work for LSVT Big as well. Our goals in therapy is to take all of this wonderful literature on multiple principles that drive neuroplasticity and motor learning and incorporate them into our treatments. And hopefully for you as a neurotherapist, that's something that you can consider for any treatment that you're doing, is am I taking advantage of these scientifically based neuroplasticity principles to really improve brain function. So these are intensity matters. We know that intensive practice is important for maximal plasticity. Complexity matters. So it's important that we not just keep our patients at a low level, but continue to challenge them, drive them to further improvements despite the progressive nature of Parkinson's disease. We know they can improve. Repetition matters. We know that Parkinson's is a chronic disease, and although we may improve them greatly through therapies like LSVT Loud and LSVT Big, in order to maintain those gains, they need to keep practicing those bigger movements, that louder voice on a daily basis, even after therapy is done. Within the treatment, there's also a high number of repetition for significant motor learning. Salience matters. We all know for us personally, when you do something that you enjoy, that you feel successful at, you're more motivated to do it. So if it's a fitness routine, if you love it, you're much more likely to do it than something that you hate. The same is true for our patients. We not only do exercises, but we think about what are the functional communication situations or ADLs or hobbies or leisure activities that this patient loves, that they enjoy, that they want to keep doing or get back to doing. And we incorporate training those functional skills and communication activities into our treatments. Timing matters. Angela said the importance of early intervention is so important, and we will probably emphasize this more throughout the session, that be an advocate for your patients, educate your patients, educate your physicians to change. If you're not seeing this in your area, of early intervention for Parkinson's gives us the best ground for neuroplasticity. And lastly, specificity matters. In the LSVT protocols, we are training the specific deficits of hypokinesia and bradykinesia. So the three key features that are common to both LSVT Loud and LSVT Big, which are standardized research-based specific protocols, are these. The first is target. Our target is amplitude. So we're working on either bigger movements or louder voice. Our mode is intensive and high effort within the session and across the treatment sessions. And our goal is calibration, so that that patient walks out the door continuing to use their louder voice and their bigger movement, even when we're not standing there cueing them, reminding them, etc. We want them to be successful long-term, even after discharge from therapy. So I'm going to turn it back to Angela for the next few slides.
All right. So to go a little more specifically into this, one of the key features of target, let's look at amplitude. So increasing loudness to normal loudness, increasing movement through big to normal movement. What I'd like you to do first is, just in a typical or even a soft voice, I want you to say out loud, "Good evening." Okay, so now what I'd like you to do is to say that again, but I want you to think loud when you do it. So, "Good evening." Without really having to think about it, only thinking loud, what happened when you did that is you automatically took a deeper breath, automatically opened your mouth more, automatically put more effort to your articulators, and what came out was healthy vocal loudness. But it all happened with that single target, which triggered this activation across the motor system. So we see the same thing in regards to amplitude with movement. Think of people with Parkinson's disease that you've seen, who have the small shuffling steps, the stooped posture. With these individuals with one single variable of think big, think about the video that Laura showed you just a bit ago. You see a lot happening: increased velocity, better gait, better arm swing. And so the beauty of these treatments is it's a single target, single focus of loud or big that has a spreading of effects across the whole system. Next slide. So let's talk a little bit more about intensity. So when we think of the principles of neuroplasticity, we see that intensity is important not only to make change, but to make long-lasting change. We like to say, don't practice until you get it right. Practice until you can't get it wrong. So with LSVT, it's 4 days a week for 4 weeks, 16 sessions in a month. This is the minimum dosage for efficacy and what the research is based on. Each of these sessions is 1 hour and they are individual. This is important. You need that individual session for pushing intensity, driving effort, and also to make the task salient, another principle of neuroplasticity that Laura touched on. Everyone is given daily homework and carryover exercises each day to get what they're learning with the therapist into generalization of the real world. And these treatments are delivered by therapists who have been certified in the LSVT treatment approaches, so they can deliver the therapy according to how it was done in the research protocols. So we're making this lifelong habit of practice. Next slide. Calibration of the sensory system and internal cueing required for this increased amplitude are really essential to get the new voice, the movement to generalize outside of the treatment room. Incorporation of calibration into LSVT treatments is one aspect that makes them unique. So as therapists, we can do all of the brilliant motor practice that we want with our clients in the treatment session, but if we don't address the sensory disorder, internal cueing, and neuropsychological deficits, the effects of the treatment are not going to translate into the real world for these individuals. The sensory disorder in Parkinson's is an area many people are not aware of. In Parkinson's disease, there's a sensory mismatch. The quiet voice feels normal to the person with Parkinson's disease. The small shuffling steps and slow movement feel normal. When we increase amplitude by getting people louder or bigger, it feels funny to them. So we'll talk about this a little more specifically in the treatment descriptions about how we help people overcome the sensory deficit. With internal cueing, Laura touched on this. People with Parkinson's disease can get louder, they can move bigger immediately with your external cue. But the minute we drop the cue, they lose the behavior because they haven't learned how to internally, independently cue themselves. A large part of the treatments is helping them learn to internally cue so they can become independent without the therapist. And finally, LSVT treatments are well suited to the neuropsychological deficits in that they have this single treatment target for the clients of getting louder, moving bigger, but with this single target. And then we see many other things happening. Next slide. I'm just briefly going to go over what happens in a treatment session to give you a little bit of an idea. The first half of the hour are the daily exercises. These never change. These are the core building blocks to rescale that amplitude. People do sustained phonation to retrain respiratory laryngeal coordination. Because of that monopitch, monotone we mentioned, we have pitch stretches, exercise number 2. And then we have people come up with 10 things they say every single day, and we practice those over and over so they become a cue or a hook outside of the treatment room to louder voice. The second half of the session is where that principle of saliency comes into play. We start simple and gradually get more complex over the 4 weeks of treatment with reading and conversation activities. And these are all personal and salient to the individual. So we find out their hobbies and their interests, and that's what they read and talk about. And then, as mentioned, we're assigning exercises for homework and carryover so they can practice what they've learned in the treatment room outside of the treatment room and get that generalization. So through this, we see that core amplitude of rescaling exercises, which then translates in the second half of the session to that increased amplitude, increased loudness in functional salient ways. So let's talk a little more about with this, that treatment exercise, doing the long ahs and the highs and lows, while it's a core building block, is not our end goal. I don't want my clients to go into a store and say, I want them to be able to take that same voice, go into the store, use it with a clerk, and be heard and understood in conversation. Next slide. So when we think about that calibration, the sensory mismatch that I brought up a bit ago, in the treatment session, we spend a lot of time addressing this. We have people record their voice and play it back so they can hear that the voice that feels normal to them is really too quiet, and the voice that feels like a shout to them is really at normal loudness. And so we do a lot of retraining for this so they can begin to feel more comfortable that people aren't going to think they're shouting, they're just going to hear and understand them with that normal loudness level. Next slide. So what about the research? I'm just going to touch very briefly on this. We have a wealth of research data. All the bibliographies are available for you. Next slide, please. And we just like to introduce this so that you do feel confident and see the evidence behind these treatments. With LSVT loud, they have been studied for over 30 years. So there have been 3 randomized controlled trial studies done, which randomized controlled trials are the gold standard level of evidence for treatments. And if we go to the next slide, I'll show you just a little bit of the evidence from these 3 randomized controlled trials. So in these 3 graphs from the 3 different studies, you'll see the number of subjects. LSVT is always in blue, and then there were some alternative treatment groups, a respiratory treatment group, untreated, and then a comparison articulation treatment group. And these are in different colors on the graphs. You're looking at changes in sound pressure level from pre to post to follow-up, and follow-up was at 6, 12, or 24 months, depending on the treatment study. Across these, you can see that for the LSVT group in blue, there were greater improvements from pre to post, and then these were maintained in loudness out to follow-up than for the no treatment groups and the comparison treatment groups. So this really shows that the behavioral treatment of LSVT loud focused on the voice is special. It's not just intensity, it's not, you didn't get the same effects from articulation. Next slide. So with this, what do the patients say? How do the patients feel? Acoustic data is great if we're seeing these changes in loudness, but what are our patients saying? This is looking at changes in how effective they felt they were with their communication. And so again, we have pre to post to out to 7 months. LSVT loud group is in the solid line. Comparison artic group is a dashed line, and untreated in the dotted line. So you see from pre to post, the people in the LSVT group noted more improvement in communication effectiveness, which was then maintained out to 7 months. The comparison artic group noted a little bit of improvement, but that was lost at the 7-month follow-up. Next slide. So I mentioned briefly this idea of a spreading of effects. LSVT loud is just focused on the target of voice. But what we've seen through our research and also noted clinically is the spreading of effects that single target of voice can have. So we see changes in respiration, changes in articulation and speech intelligibility, preliminary data showing changes in swallowing, facial expression, and we also have some very exciting neural imaging data. So this target of voice is causing the spreading of effects across that motor speech system. All right, so next I'm going to turn it over to Laura to talk about Lsvt Big in more detail.
Great, thanks, Angela. So like I said before, after all of these years of research, over a decade of research, establishing the efficacy of Lsvt loud as a speech treatment to impact hypophonia in people with Parkinson's, the question came up of could we use these same principles to address hypokinesia affecting limb motor movement, and that is why these treatments are parallel. And let's now take a look at what Lsvt Big looks like. This is a snapshot of a 1-hour treatment session. You would do all of these things with your patient. Starting on the left side, there's a core set of what we call maximal daily exercises, where we work on large amplitude movements in all planes, both repetitive movements, rocking movements, and sustained movements as well. And I'll show you pictures of those in the next slide. Then we work on translation to function. So we work on things called functional component tasks that are very simple motor tasks, such as sitting to standing, pulling the keys out of the pocket, reaching for something, using a cell phone. And we train those repetitively so that they became a hook or a way to remember how to move big in everyday life. So that helps with generalization as well. We also train more complex tasks that we call hierarchy exercises because we practice them in a hierarchical fashion. They could be things that are as simple as getting out of bed or getting out of a car. They could be things that are more complex, like cooking a meal, playing golf, really anything like that. The point of these is that it's training them how to incorporate amplitude into function that is meaningful to them. Every patient works on some big walking, whether it's short household distances that is relevant to them or much longer distances in the community or related to their work. Every patient also does homework exercises during the 1 month of treatment and after the 1 month of treatment. So the structure is the same. We have these core exercises that are building blocks to train them how to generate bigger movements and how those feel, so that they can then incorporate those larger movements into functional tasks important to each person. These are some photographs of the Maximal daily exercises. Obviously, they're static, so you can't see the movements right now. However, the first two where Jenny is sitting, they're sustained activities, working on dynamic stretching and posture. The next three are stepping directions, forward, backwards, and sideways to work on multi-directional movement. And the last two are rocking and rotational activities. These are practiced repetitively every session. We make them more challenging as time goes on. And for people that are lower functioning, we can adapt them to sitting or even supine. How do the Lsvt Big exercises help you? Well, first and foremost, like I said, they're to train amplitude, but there's secondary benefits of training them how to start and stop movement upon command. Freezing and festination is common, so it's important to train that in. They work on directional changes. They build endurance or stamina, and many of our patients come in already quite deconditioned. They improve balance, strength, range of motion, and posture, and these things have been validated through research studies over time as well. And so we do tell patients that although we're working on amplitude and focusing on amplitude, you're going to see other benefits in your movement in everyday life as well. Part of the session then, like I said, is functional activities, and this is very much personalized. So even though it's a standardized protocol, as a therapist, you really have to dig in, get to know your patients so that you can choose activities that are meaningful to them, such as getting out of a car, putting their socks and shoes on, buttoning their buttons, etc. Our goal is to not make them masters at their exercises, but to teach them this is how you move your arms really big like this, so that when you go home, you can train and use those big movements to reach things off of those high shelves. So we want our patients to see that link to function, and we specifically work on those functional activities. We do this also through calibration training. So just like in LSVT Loud, many patients don't perceive that they've lost arm swing, that their posture has changed, that they've really slowed down so much. Oftentimes they attribute it to normal aging, and we can show them through standardized tests that it's much beyond normal aging. So calibration training addresses the mismatch between their perception and how others do it, perceive it. We do a lot of videotaping, a lot of feedback, and a lot of exercises to get them more comfortable with using bigger movements in everyday life. Let's take a brief look at the research on Lsvt Big. One of the earliest studies, published in 2005, looked at the effects of Lsvt Big treatment in terms of amplitude and velocity. The black bar is pre-Lsvt Big, the gray bar is post-Lsvt Big, and you can see that the reaching amplitude and velocity improved, as well as the gait velocity and stride length. This was the randomized control trial published in 2010 in movement disorders with 60 patients. 20 did Lsvt Big, 16 sessions. 20 did 16 sessions of Nordic walking that were also 1 hour long, and 20 did an unsupervised home exercise program group that was specific to Parkinson's disease. The primary outcome variable was the UPDRS motor score. It was a blinded rating, and the dashed line on the bottom is the Lsvt Big group. So a decrease in the UPDRS motor score signifies an increase in or an improvement in their motor function. So Lsvt Big was the only one to make improvements, and the amount of change was significant, and the difference between groups was significant as well. There have been other studies, including an additional randomized control trial and a number of phase 1 studies showing improvements in all of these things that you see listed here on the slide. That we continue to see new studies published all the time. Our most newest studies have been on improvement in dual tasking and occupational performance. So we're excited to see all of that research continuing to come out. I'm going to turn it back to Angela for a quick snippet on application to other disorders.
Thank you, Laura. So the question you've seen, we have this wealth of data, randomized controlled trial data for people with idiopathic Parkinson's disease. But what about other conditions? Well, we do have some single subject, small group design case studies with some of these other neurological disorders that are listed here. And on this, all the studies in black are LSVT, and the ones in blue also include Lsvt Big. So with this, when individuals, therapists are trained in the LSVT approaches, we have a stimulability protocol section. And so we train the therapist, how do I, if someone doesn't have Parkinson's disease, decide if LSVT could be appropriate to them. Next slide. And so with this, we have more information in the reference section on our website, and it's divided so you can see some of the pediatric applications, the other neuro applications, other disorders. We have LSVT Loud with technology, telehealth, and so feel free to go to this section and you'll see that wealth of research data available for you. LSVT, it's important that people continue to practice. It's an exercise program. I tell my patients you're going to practice every day forever and ever. So we implement them with what they need for success. And following though, there are other ways to motivate to help with this. There's videos that are available. We've developed group exercise options. These are called Loud for Life and Big for Life. And this is for people to come together once they've graduated from their individual therapy and practice together with other people who are also LSVT graduates in a fun, motivating environment full of camaraderie with people who understand what it feels to feel too loud when you're talking at normal loudness or move too big. And the support from each other can be huge for these groups. They're offered in person and via teleclasses. We also recommend people go to their therapist every 3 to 12 months for a little tune-up and check-in. And other exercise and fitness activities are really encouraged as well. The next slide. If you have a patient who is interested in participating in LSVT Loud or LSVT Big treatment, they can go to our website and there's a big orange button, Find LSVT Clinicians, type in where they live and search for clinicians near them. If for some reason they can't find a certified therapist, we also encourage people to contact us directly, and we're happy to help to see if there's not someone locally, maybe something could be done via teleservices, but there might be other options for that individual. And we also offer a wealth of other resources on our website that we welcome you to check out. We do free monthly webinars to the public. These are all then recorded for on-demand viewing, and we do those on a variety of topics, mainly based on feedback we get from people that they would like more information about. We have a wealth of information on our website that's educational, blog articles, testimonials, more pre-post videos if you want to check those out, and a Facebook page. And we're always available for questions. So as we move forward in summary, what we hope you've gleaned from this hour with us today is how LSVT Big and LSVT Loud can address those core symptoms which all patients with Parkinson's disease will experience. The smaller movements, the softer voice, that sensory mismatch. You've seen how this intensive training and practice that's supported by theories of motor learning and neuroplasticity are important to incorporate in these evidence-based treatment approaches. And while the treatments are standardized protocols, we've shown you how they can be individualized and adapted both across disease severity and to the individual patient goals and needs. There's the robust data to support improvements in voice and speech and motor functioning. And we've also talked about the application of these treatments to other neurodisorders and shown you some resources for ongoing support for people with Parkinson's disease. We're going to now talk a bit about training if you are interested in getting certified in the LSVT approaches, and I'll turn that back over to Laura.
All right, thanks. So if you are interested in getting certified yourself, either now or in the future, there's two main ways right now that you can do so, even from Africa. One is the online LSVT Loud and LSVT Big training and certification courses. These are fully pre-recorded courses that contain a ton of videos, video-led practice time, and you can complete it at any time on your own schedule. They take about 12.5 hours. However, you have 60 days to complete it. The other option that's fairly new is our virtual live LSVT Loud and LSVT Big training and certification courses. And these take advantage of using the Zoom platform to offer you part of the training that's virtual, interactive with faculty, with other learners, and we even bring in some volunteers with Parkinson's disease. So it's been really fun to start to offer these in 2020. We've listed the upcoming virtual live dates in case you're interested in them. To find these courses, either online or live, you go to our website, click on the orange Get LSVT Certified button at the top, and just follow the path where you select your profession type and course type. Now, please note that the virtual live training is under the live course button, and online has its own button. So we're close to the top of the hour, but Angela and I are going to stay on for a while for questions. We're happy to answer whatever questions you have, really, and we'll start with the ones that you've already typed in. To type in further questions, just type them into your control panel and we'll take them as they come in. You can also raise your hand and ask your question out loud. In order to do that, we'll call out your name so that you know it's your turn. Make sure your microphone is unmuted when you do that before you ask your question out loud. If you need to hop off and get back to your evening, that's totally okay. You can email us at any time at info@lsvtglobal.com with your questions, and our office staff will direct it to the right expert to answer your questions. So if you do log off too, please do remember to complete the survey as it launches. Okay, so I'm going to open up the questions here.
And I did a little research on one of the first ones while you were giving those instructions, great. Laura. So one of the questions came in, if you are interested in participating in the virtual live course, what time would that live course start in CAT time? And I just did a time conversion, and that would be 6 p.m. It would start CAT time, and it's for 5 hours. So it would go till 1 a.m. So a little bit late in the evening, but I will tell you for our previous virtual courses, we have had people joining us. We had a few from someone from Malaysia who was actually going until like 1 or 2 a.m. their time. So the virtual courses have a pre-recorded portion and then 5 hours on 2 different days of a live portion. So if that is something you're interested in, that would be the time difference on that. And then I can take this next one as well. It says, what are the differences between LSVT Loud and Speak Out? So LSVT Loud was developed over 30 years ago and is the only voice and speech treatment with randomized controlled trial data. So not just for Parkinson's disease, but speech treatments in general, it's the only voice and speech treatment with that wealth of evidence. So really looking at treatment approaches, the main difference at this time between LSVT Loud and Speak Out are the research base. LSVT Loud has a very wide and deep research base supporting that efficacy behind it. And also the difference in the descriptions that we've gone through of the basis of how it's formulated. So it was really developed for what are those deficits we see in Parkinson's disease. So we see the hypokinesia, we see the bradykinesia. So the treatment targets are directly focused on what we see in Parkinson's and making those changes based on those deficits and targeting those sensory components. So those are some of the, just in a nutshell here to save time, basic differences. Any treatment you do, whether it's for voice, speech, physical therapy, swallowing, whatever, we always tell people look at the research evidence behind it because you want to do treatments that have that research support. So I'll turn over the next question to you, Laura.
Okay, thanks. I'm going to answer a few questions in one fell swoop. I know a few of you had difficulties with the videos, and I'm sorry about that. But I want you to know that the session is being recorded, and within a week, we'll send the handouts of the posters and the link to the recorded session that we have today so that you can rewatch it if you want to, and share it with your colleagues that weren't able to join as well. Also in the handouts, there's a URL where you can go directly to our blog and watch those 2 videos that we played today on Shirley and on Bernie. Okay, so here's a question. Can this treatment be effective with patients who we cannot see every day for a month? There may be financial implications whereby patients can't afford the sessions, or they may have work commitments. And do you want to start with that one, Angela?
Yes, so a couple of things for LSVT Loud as far as the daily. So we know from what we've presented here that intensity is important. And these are a couple of things when, again, comparing treatments that make the treatment unique in that LSVT Loud is 4 times a week for 4 weeks, 1-hour individual sessions based on the principles of neuroplasticity, that intensity is important to make change. Other treatments don't have that type of intensity. So we know that's essential for making change. With LSVT Loud specifically, some things that can be done are using telesessions. So perhaps, and this is also, you know, in light of COVID right now too, if someone can't come to see you 4 days a week because they live too far away, they have transportation issues, you could do part or all of the sessions via teletherapy. There is also some other software devices that could be available depending on where people live to help them practice the voice exercises. So we look at how do we maintain that intensity, but being able to deliver the treatment in other ways. And Laura, I don't know if you want to address that for Lsvt Big more specifically.
Sure, absolutely. I would say that telepractice of Lsvt Big is just really launching this year as in response to the changes in COVID. However, we're excited about that and feel like that is a potential to address patients who can't get to the clinic for every session, or maybe not any of the sessions as well. The other thing that I'll say in terms of the intensity is at sometimes patients are initially a little bit reluctant, that it seems like 16 hours is a long time. However, I found through my own personal clinical practice that when I educate them and really talk to them about the value, the evidence, the efficacy data, oftentimes they get on board and make it happen. Sometimes it might be 6 months later or so, but I think your best tool is to educate them, to empower the patient to make a decision that's best for them. And sometimes that goes for financial decisions as well, that the patient says, well, I can't quite do this now, but, you know, maybe in a year from now, or, you know, with support from family or friends that I'm going to reach out to, I want to make this happen because I know it's going to impact my quality of life so much. And in our blog, we have different webinars. We have one on barriers to treatment and solutions, more importantly, for those. So if you want to dig in a little bit deeper, we have some great resources for you. This question is just about CEUs, and I'm glad you brought that up because we had a question in our last webinar about this as well. We haven't applied specifically to the HPCSA for CEUs. However, we may be able to give you a certificate that you can use for self-report. If you'd like to email us at info@lsvtglobal.com or indicate so on the handout that you'd like a certificate of participation, we can certainly provide you with one as well. Just scrolling through to see if I have missed any other questions, Angela.
I'm scrolling as well. If there were a couple about the training itself, payment, things like that, if you would, we'll follow up since some of these are a little more individualized with you specifically on those. And then also if people have questions about that directly, you can always feel free to contact us with those questions as well. And we can follow up with you on that.
Okay, I think we got them all. And again, if we didn't and you think of a question, you can leave it on the webinar survey or you can email us as well. Okay, well, I think that is a wrap for this webinar. Again, we're so grateful that you took time out of your busy evening or day to join us. We hope that you enjoyed this webinar as well. Please complete the survey, and if there's anything we can do to help you and your patients with Parkinson's and other neurological disorders, please reach out. We'd love to continue this conversation.
Thank you.